University, Rockefeller 102. And you don't need any experience to join us. We welcome everyone from all experience levels to come and debate with us on serious scientific issues. So today's topic is the Affordable Care Act beneficial to the medical field? So I'm going to talk about a little bit about the Affordable Care Act. It is also called Obamacare, and it is the most significant healthcare reform in the U.S. since 1965, when Medicaid and Medicare was passed. So what are some of the goals of the Affordable Care Act? Well, basically it wants to extend coverage to more people and increase the number of people who have health insurance. And second, it wants to hold insurance companies accountable. So it gives more rights and protections to American people. And the government has to make sure that insurance companies play by the rules, such as the minimum standard for what insurance could be. And the goal of the Affordable Care Act is to lower healthcare costs, guarantee more choice, and give American workers more independence from their employer and insurance companies for medical care. So overall, we want to enhance the quality of care for all Americans. But there are some very controversial things regarding the Affordable Care Act. So for example, as you all know, like in the U.S., political parties have opposed the passage of the Affordable Care Act. So like in 2013, it was partially responsible for our government shutdown because Democrats and Republicans couldn't find a compromise. And today we're not going to actually focus on the politics or the constitutionality of the Affordable Care Act. We're going to talk about how it affects medical school students, physicians, people like you and me. So some of the controversies regarding the Affordable Care Act is like the individual mandate, which requires Americans to obtain health insurance by 2014 or pay a tax penalty. As you know, we all heard about, could be compared to the Gannett $350 controversy, in which students have to pay a healthcare fee even if they have their own health insurance, just so Gannett could keep on running with the pool of money. And of course, it is still being, it's no longer challenged as being unconstitutional because in 2012, the Supreme Court said that it will remain the law of the land. And right now it is September 2015, so we can see some early impacts about what has happened. As you can see here, 16.4 million people have gained health care under this act, which brought down the number of uninsured Americans to 11.9%. It is a really good success. And also it helps to reduce medical bankruptcy, which is currently the leading cause of bankruptcy in America, constituting 62% of all bankruptcies. So, about the Affordable Care Act, most people either love it or they hate it. And if you don't know anything about it, we're here to educate you about it, help you make a decision today. And I want to make a disclaimer that the video taken by debaters do not represent their personal opinion on the topic. It's just for educational purposes, and so if you really don't like what they say, don't hold them accountable. You can come up and talk to us afterwards about your strong opinion. We're more than happy to listen to you. So we have 4 speakers today. On the affirmative side is Alex Chakram and Richard Chin. And on the negative side will be Jonathan Gorman and Safam Jalal. So this debate will take about 30 minutes, and here's the format about how they will go. So basically, we're going to present a constructive speech and then a rebuttal speech, which is a response to the opposing side. Before we start, I just want to know, show of hands in support of the Affordable Care Act is beneficial to the medical field. Okay, show your hand if you don't support it. Okay, thank you for your response. So now I would like to welcome our first speaker, Alex.
I'm proud to open this debate on the Affordable Care Act. It is a transformative act that will transform the medical community, an effective medical community for years to come. Some people are unsure whether the act is good for the medical community, but we believe that the question of this debate is not whether or not the government should take over the business of healthcare. Richard and I are proud, red-blooded Americans who do not propose a government takeover of the healthcare industry. However, we believe that for far too long, the quality and cost of healthcare have gone unregulated by any agency, and millions have been left outside of the healthcare system. Because we believe Obamacare has changed the way in which the number of people who have access to care, as well as the number of individuals that have a higher quality of care, we are proud to support the Affordable Care Act in all of its glory. Thank you very much. So here's some essentials of the Affordable Care Act. One, a mandate for individuals and businesses requiring as a matter of law that every American have an approved level of standard of health care or pay a penalty. And we are proud to have that penalty in place because it means that individuals are not left going to the hospital room without insurance, and hospitals are going bankrupt because these individuals are going to this room, and because of the Hippocratic Oath, they can't refuse these patients. We would much rather prefer a world in which these individuals have health care and they're able to get treatment, and we believe it produces a much healthier society overall, and especially one that emphasizes preventive care rather than the status quo in which it primarily emphasizes very expensive surgeries. And second, the system of federal subsidies to completely or partially pay for the now required health insurance for about 34 million Americans who before the law were uninsured. Subsidized through Medicaid, expanding Medicaid to 133% of the poverty level, as well as ensuring that these individuals have tax credits if they fall above that level, and they're able to purchase plans through part of the healthcare exchanges under the act, where you have this pretty much like a healthcare mall where healthcare plans are competing to drive down the cost of care, where they're all offering these different healthcare plans. You have subsidies in place to help people buy these healthcare plans. But you also have the free market which drives down the cost of these plans, and more people are able to get access to healthcare. You can see with the numbers, with 16.4 million Americans who have been able to get health insurance under this law, you have much greater people utilizing the healthcare system, and this is a good thing. More people are getting access to care, more people are being treated for dangerous diseases. It's better overall. And next, numerous regulations on the practice of medicine. For example, healthcare companies now have a cap on the out-of-pocket care, and there's no copay for preventative care. Insurance companies, they're forced to cover pre-existing conditions. You're no longer able to have men and women pay different rates. These things have to be put into law, and insurance companies shouldn't be able to discriminate against people with pre-existing conditions. Other regulations, like people being able to get health insurance once they turn 26, means that you have many more people who have care than ever before, and you have people who are living much healthier lives as a result. So the website may not have worked. But however, as future medical leaders, we would be remiss to believe that you should throw the baby out with the bathwater because of the number of people who have been able to get health care under the law. When 16.4 million Americans are getting health care, and the share of the uninsured among 18 to 64-year-olds falls by 3 percentage points to 15.7% in the first quarter of 2014 in states that expanded Medicaid, compared with a drop of 1 percentage point to 21.5%. This compares to 37% in this age group from 2008. Overall, more people are getting health care, and this is a better thing in our world because it means that people have higher standards of care and lower costs relative to inflation because of cost controls put into the act. So 2 points why you should support the Affordable Care Act. One, it creates more demand for primary medical care. There's a study from Glide and Ma from New York University that analyzed trends in expected healthcare use among the newly insured in every state, looking primarily at primary and specialty care, emergency room care, outpatient and inpatient services and prescription drugs. They estimate that emergency room visits are going to rise 2.2%, and the amount of primary care visits are going to rise by 3.8% nationally. More people are going to demand these services. There's going to be a larger market for healthcare all across the board. More people are going to be able to not only get care, but utilize these services, which create more demand within the medical community for doctors, for people, for PAs. Pretty much anyone who's pre-health will be able to get employment as a result of this act, and you're going to have increased demand within the medical community for people to actually go into the community, but also for doctors just overall. This is a good thing because it ensures that there's going to be people who will treat underrepresented communities, my second point. So the ACA provides an incentive for doctors who serve poor urban communities. Healthcare previously was really only affordable if you're looking to serve these, if you're someone who's right out of med school, they're looking to figure out where they want to serve, where they want to spend their time in terms of employment. But it was really only profitable if you served Cadillac healthcare plans, the elderly, people who had like high demands for healthcare. We believe that the Affordable Care Act has changed this because it meant that these poor communities which didn't really have access to healthcare, you didn't have a large amount of individuals who were insured, didn't have real access to care. You didn't actually have incentives for people to treat these individuals because there wasn't like a group of, there weren't actual individuals within these communities who were able to afford services. At least the Affordable Care Act creates centers, part of the law creates Community Health Center Fund, which provides $11 billion over the next 5 years for the operation, expansion, and construction of health centers throughout the United States, which means that poor, underserved communities now have some type of ability to get doctors that they never were before. They actually have access to care where people are going to treat communities that previously didn't have access to doctors' offices, didn't have access to hospital care, preventative care. You have much more, not only demand for these services, but you have market incentives that ensure that you will have people to serve these underrepresented communities. And the second point is that you also create incentives for people to treat rare diseases, because diseases become less rare overall, and the more people overall in the healthcare system utilizing services. You have demand throughout the medical profession to solve a lot of problems that previously might have gone unsolved, because now you have more people who might be exposed to these rare diseases, and you also have an incentive between medical companies because you have more people insured to treat these kind of diseases and make sure that you get the medical research to solve these problems and actually treat these individuals and get drugs out to the public. So because of these incentives, the way that you create more demand for primary care and the way that you treat these underserved communities, we are very proud to propose the Affordable Care Act. We hope it stands. Thank you very much.
Thank you to the first speaker. So, the Affordable Care Act was intended as a way to reduce costs and expand coverage for Americans. However, regardless of whether it's effective in accomplishing these short-term goals, I think the Affordable Care Act will have unintended long-term consequences on the medical field. And I'll talk about two ways in which this will happen. One, the Affordable Care Act has provisions which will discourage innovation and investment in medical research. And two, the Affordable Care Act will reduce the wages of doctors and create disincentives to joining the medical field. So to my first point, pharmaceutical companies. They're unique in a special way. They're unique because they're very high-risk companies. It's estimated that to develop a new drug and put it out on the market, you have to spend $1.3 billion before you make any profit on it in the pharmaceutical industry. That's a very big investment, a very large risk. And for pharmaceutical companies, in order for it to be worth making that large investment, they need to know that they're going to make a very large payoff. Otherwise, they're not going to invest in these new drugs. And this can also apply to medical technology. Now, the Affordable Care Act has many provisions in it that try to reduce the cost of drugs and medical devices, which in turn will reduce profits for pharmaceutical companies. The goal is to reduce costs for consumers, but the unintended consequence is it will reduce the investment in research and reduce the investment in new drugs. So let me give you some examples of these provisions. One, there's an excise tax on medical device sales. There's also fees for branded prescription drugs. The Affordable Care Act expands the Public Health Service Act, so companies that manufacture equipment or pharmaceuticals will have to provide their products to certain providers, such as children's hospitals, for vastly reduced prices. And also manufacturers have to pay additional rebates under Medicaid in order to reduce the coverage gap and make healthcare more affordable. In addition to all these measures that make medical technology less profitable, the Affordable Care Act has provisions that increase the amount of competition in the marketplace for drugs and technology. For instance, the Affordable Care Act makes it easier to get biosimilars approved. So biosimilars are like generic drugs. They are imitations of drugs that are already on the market, except this is specifically for biologics, complex molecules like antibodies. This does two things. One, it makes biologic drugs less profitable for pharmaceutical industries, but perhaps even more importantly, it creates an incentive to copy drugs that are already on the market rather than invest money in new drugs and new products that might actually be useful in fighting disease. So overall, the impact that the Affordable Care Act will have on the technology and pharmaceutical industries is negative because it will discourage innovation. And if you are a wealthy pharmaceutical executive, this might not all be a bad thing. You could, for instance, focus more on investing in biosimilars and make a large profit from it. However, if you're genuinely concerned about seeing more drugs on the market, seeing progress in the fight against disease, it should be very concerning that the Affordable Care Act reduces the incentives to innovate. I want to also get to my second argument, which is about how the Affordable Care Act will reduce the pay and working environment of doctors and discourage people from entering the medical field. Now, the first speaker talked briefly about how the Affordable Care Act creates a market, creates increased demand for doctors and encourages people to enter the field. The problem is, in order for the increased demand for doctors to lead to more doctors, there has to be more market incentives for people to join this profession. The problem is, the Affordable Care Act, which is aimed at reducing costs, will likely reduce the salaries of doctors and medical professionals and reduce the quality of their workspace environment. We think, when people are considering whether they want to join the medical industry, they need to know that it will be worth the very high cost of medical school and college, and we think these disincentives will be a barrier to some people and will prevent some people from joining this profession. So let me give you some examples of how the Affordable Care Act reduces incomes for doctors. In order to participate in healthcare exchanges, insurers have to reduce costs. And part of this means reducing the amount of money that goes to doctors. Also, the Medicare Payment Advisory Commission, as part of Obamacare, plans to cut the payments made out to specialists by 16.7% in 3 years. These are just some of the ways. But in addition to reductions in income, doctors will experience a lower quality work environment. So there are provisions in Obamacare that relate to increased accountability to insurance companies and to the government. These are accountability for all the costs of medical care. What this involves, as an unintended consequence, is far more paperwork that doctors have to do to account for every single procedure they do, all the prescriptions that they make, etc. This means that doctors will be spending more time doing paperwork and less time doing more fulfilling and important tasks like helping out patients. Additionally, if Obamacare is effective in increasing access to health care, one major unintended consequence is that there will be a higher patient-to-doctor ratio, which means doctors will be spending less time with each patient. This means doctors will have a more stressful work environment, and also patients will have a lower quality of care. So, as I said in the beginning, regardless of whether Obamacare is effective in making healthcare more affordable and increasing the access to healthcare, it will have very negative unintended consequences on the medical field. It will hinder our fight against disease by removing incentives to innovate and invest in new research, and by declining the quality of the medical field, it'll reduce the incentive for young, talented people to join the medical profession. Thank you.
Okay, so I had my Orgo prelim come back this morning, and in light of my existential crisis about being a pre-med, I'm going to make this speech about students, about pre-health students, about medical students, specifically how the Affordable Care Act affects medical school and how those changes benefit students like us who are thinking about going to medical school and how that affects the medical school experience. But first, let's talk about the things that Jonathan brings to us. He has two arguments. The first argument is simple, right? Harms against big pharma, pharmaceutical companies, and the medical industry, right? He says when you impose new fees on these companies, it disincentivizes them to innovate, right? Disincentivizes them for making new drugs. The problem with this argument is that these fees are being applied by Obamacare don't happen in a vacuum, right? So these companies lose revenue through fees, but they also gain massive amounts of revenue through the huge surge of new consumers who will be entering, be getting healthcare coverage, and be now are able to buy these drugs, new drugs that these pharmaceutical companies sell, right? So that balances out a lot of the harms and loss of revenue that Jonathan talks about. But even if Jonathan can prove that on net, right, revenue for big pharma decreases, we actually don't mind that. Because right now in the status quo, big pharmaceutical companies have massive 20-year patents, which the government basically gives them, right? And what these patents do is they actually disincentivize innovation when a big pharmaceutical company no longer has to keep innovating its drug. When it has a 20-year patent and no other company can innovate on that drug when they have that massive patent. So we don't actually mind reducing the size and the power of big pharma companies like Pfizer, for example. Okay. Then he gives the second argument about doctors. He says, look, it's going to be more stressful for doctors, there's more bureaucracy, right? Lesser income for doctors. The thing is, this is a problem with what's going on right now. This is a problem with the status quo, right? There's already massive amounts of bureaucracy. We already don't have enough doctors. And the root of this problem is just that we have a shortage of physicians and we don't have enough medical resources to go around to the massive number of people who need sufficient health care. What this means is that on their side, they don't really solve that much. But on our side, we do have some ways of increasing the number of physicians through increased admissions to medical school, things that I'll explain in my speech. So we don't think a lot of the things that Jonathan talked about really matter when you think about the comparison between what the Affordable Care Act offers and what's currently going on right now. Okay. I'm going to talk about three basic benefits to medical students and to medical school in general that I think that are really important to consider in this debate. The first one is quite simply the number of people and students at medical schools admit, so admission rate. What the ACA and Obamacare does is that it allows 32 million newly insured Americans to enter the healthcare system. What this does is it puts a massive amount of pressure on the healthcare system. It says, look, we have a physician shortage, and that shortage really matters because now we have all these people who need healthcare. It makes it a critical issue to the government. It says, this really matters and has to be addressed. In response, what medical schools do is that they increase enrollment. And the ACA facilitates this by increasing the number of federally funded residency training positions. So these are training positions after you go to medical school, right? You go into residency, etc. And because in 1997, what Congress did is they actually froze that number. They said that the number of training positions in the country has to stay at this level, right? So that limited the number of physicians who could enter into the healthcare field. But now that number is going to increase. And so what has basically happened is that medical schools over the past 8 years have steadily increased the number of students that they accept by 2% annually. And furthermore, right, like enrollment of, for example, underrepresented minority groups, that has increased by 5% every year. So that's an incredibly important benefit considering the shortage of physicians that we have, and considering all of the harms that Jonathan talks about with the current situation in healthcare. The second benefit has to do with primary care specialties. What are primary care specialties? Primary health care is basically like day-to-day health care that is unspecialized. Things like family medicine, things like internal medicine. And this kind of health care is much more accessible than specialized care. People who have access to regular primary care physicians are more likely to receive things like preventative care and timely care than ones that have to access specialized care physicians. Unfortunately, 1 in 5 adults in America report a delay of 6 days or more to see a doctor. This means that many adults who require care outside of normal hospital office hours actually have to go to hospital emergency rooms to get the health care that they couldn't have gotten from a primary care physician. So what does the ACA do to solve this problem? What it does is it puts an emphasis on primary care especially. It does this through things like putting 10% bonuses to primary care providers and reimbursements to beneficiaries of primary care, so people who buy primary care, right, and who participate in Medicare. And with the addition of things like primary care scholarships to students, more medical students are drawn into primary care specialties. The reason why this is so important, the reason why this is so beneficial, is because primary care specialties like internal medicine, family medicine are the most popular specialties and the most popular fields within medicine. So the ones that students are most likely to be interested in. So that's like a massive benefit considering the people here. All right. The third benefit is quite simple. It's very broad. It's just the general benefit of having more coverage to young people. What the ACA does is that it allows young adults to stay on their parents' insurance until they're 26. This gives 3.1 million young adults health coverage. That's a really good thing. The rate of uninsured individuals between the ages of 19 and 25 has decreased 40% in the past 5 years. And outside of the coverage of like your parents' coverage, a further 2.2 million young adults obtain coverage through the marketplace, which is the government's online way of facilitating you choosing what private healthcare you want. This is really important, especially since young adults oftentimes have the mindset that they are invincible, right? They don't have the conscious awareness that maybe they should be worried about things like injuries and illness and how that can impact their careers. So this is a very important benefit considering that all of us here are young adults. So what should you think about at the end of this debate? You should not only think about all the things that Jonathan talked about, bureaucracy, physician shortage, problems that already exist in the current situation, right, and that we have shown may or may not be solved by Obamacare. But you should also think about the benefits to you, the students, to medical school, for example, in terms of admission, etc. That's why me and Alex are very proud to affirm Obamacare.
You are here with AD Tao Chinese with her.
Look, we want better healthcare for all Americans. I think that's something that both of us can agree on. But this isn't the right way to do this. What Richard and Alex proposed to you is expanding a broken system and infiltrating and propagating its systemic harms into huge swaths of society. What me and John tell you first is that we have to fix this system. We have to do more to make the Medicare expansion better, to make the Medicare expansion better, before we introduce these problems into large portions of society. So what I'm going to do to you in the speech is basically tell you how Richard fails at meeting each of his objectives, right? I'm telling you why this really doesn't, while increasing coverage, doesn't increase access to healthcare. I'm going to tell you why this makes life worse for doctors, and I'm going to tell you why this doesn't even help the patients that it was designed to help in this policy, right? But before that, I have one extraneous point of rebuttal that came up regarding how Richard dealt with John's arguments. So Richard basically took a cop-out view when he's like, oh, when Big Pharma gets less money, we're fine with that, right? Because they already have monopolies and they have 20-year patterns and these things like that. And then he like had a simple response to that, where he's like, when you gain new consumers, you have a net increase, or that balances the money out in that sense. We tell you this is wrong on two parts, right? We tell you that even if you like buy the argument that Big Pharma shouldn't get that money, there's tons of other medical companies, like companies that make MRI machines, that make CT scans, that make Doppler scans in order to do things like diagnose miscarriages and other like important things like that much easier. We tell you that the excise taxes, which are running about 2.3% right now at these various technologies, right, hinder the development of these technologies because companies that create these cutting-edge technologies don't want to invest in them because they think it's a risky endeavor that they otherwise invest in other technologies, right? So he tells you that that already is a net harm in itself. And then what does he tell you after that? He's like, well, a lot of people think like are becoming insured in this case, right? Because they think, and that's good because a lot of young adults think they're invincible, and need these protections and these harms. Well, we tell you, then why is it that 33 million Americans still don't have insurance, right? We tell you that while like 9 to 10 million people have now become insured, the vast majority of people that were uninsured before Obamacare are still uninsured. Richard never deals with that and do these things, right? He never tells you why the vast majority of young Americans would rather pay the $95 tax penalty than pay the lowest level premium, which is still much more than they can afford, even with the highest government subsidy, right? Richard never engages with those things in that sense. But moving on, and I'm going to talk to you in 6 reasons why this is bad for doctors, why this is bad for patients, and why this is just a bad policy in general. So first of all, Richard comes up here and tells you that Congress froze residency in 1997, right? And it's going to magically increase the number of residency slots, right? We tell you that even if medical schools increase the number of slots that they're going to have, which they will, it's estimated by 2024, they'll increase the number of students they select by 15%, right? They won't increase the number of residency slots because hospitals are so poorly understaffed, so poorly undermanned. They don't have the resources to train that number of doctors, right? They don't have the resources in order to do these things, so they can't handle this influx of mass shortages. That's why we're expected to have that shortage of 91,500 doctors in 2024. It's not that we can simply wave a magic hand and just have new doctors like coming in to fill a shortage, right? Richard never engaged that in that sense. But moreover, we tell you that doctors can't help the people that actually need this the most, right? The people that were previously uninsured before Obamacare, right? Richard's like, there are now incentives to join, to become a primary care physician because they will give you a 10% reimbursement. Well, there's a reason why only 46% of physicians accepted Medicaid policies in the first place, right? We tell you that doctors per capita only received about 76% of the payment that they were due to receive for minor procedures that they performed on a day-to-day basis in the hospital. What does this mean? This means that doctors are consistently getting paid less and less money, right? Even with the maximum government subsidy, they still can't go, like the government can't afford to pay these doctors their due. That's why a ton of doctors are shying away from primary care because, like, even if they want to help these individuals, they can't afford to take a 41% decrease in their pay over time, right? Doctors have to break even too. They have to support their families, and the hospitals have to keep running in that sense, right? That's why that's impossible. Furthermore, that's also the reason why a recent survey came out in The Economist that 18% of doctors reported that they would not take uninsured patients, right? Compared to the 33% of doctors that said that they would not take patients on Medicaid. Why is that, right? We tell you that having coverage doesn't necessarily equal access to healthcare. The low-income communities that they're trying to save in these cases and by giving them healthcare this isn't even going to work, right? So if I'm living in Detroit, right, and I have access to healthcare, or if I have like insurance coverage, I still can't go to see the doctor. Why? I couldn't go to see the doctor previously, not because I didn't have any insurance, but it's because literally the hospitals around me don't have the resources in order to give me basic procedures, right? They don't have IV pumps, they don't have beds, they don't have basic things like that, right? In 1960, Detroit had over a dozen hospitals, now it only has 4. politicians are not able to understand the systemic harms that plague these communities, right? This is why even though tons of people have coverage, they're not able to access that health care, and all they do is provide a band-aid solution, right? Now you see the rhetoric from politicians become more about which increases access to health care or which side increases coverage the most, instead of focusing on these basic issues, the actual issues that we should be talking about, like why these communities don't have the resources that they need in order to do these things, right? Another thing that they do is they reduce preventative care aspects and increase bureaucracy and red tape into the doctor-patient relationship, which effectively hinders it and impedes it to a degree that it's unsalvageable, right? We tell you that when you get assigned a primary care physician, right, there aren't enough doctors in order to take care of the mass influx of patients in these communities. But furthermore, more than that, the policies that these physicians will abide by are created by a series of 12 bureaucrats sitting in Washington who know nothing about the medical process, who probably never practiced medicine a day in their lives, and they create a ton of red tape, which involves cataloging and doing various extraneous procedures that individuals shouldn't or can't even do, right? We tell you that these are the problems that are associated with these things. We tell you that we should maybe put more money into Medicaid, maybe divert some military funding, and do an F-16 costs $164 million that could give 25,000 people insurance coverage for a year. We think the government poorly funds these endeavors, right? And we think that they should focus more on that instead of putting a financial strain on a broken system, putting that on the backs of taxpayers, and hurting the people that they want to protect the most. We think that because Richard and Alex failed to meet these burdens, they have lost this debate. Thank you.
Okay, so